Hello, today we're going to look at an article by Anita Gupta, and the article is centered around opioid dependence and how we can tackle a growing problem in the Western world. Her article is called "We Need to Reassess How We Measure and Treat Pain as Opioid Addiction Grows." So, what is an opioid? An opioid is a natural derivative of opium, or a synthetic substance that has agonist or antagonist activity at the opioid receptors. Now, opioid dependence usually develops after a period of regularly using opioids. The American government, scratch that. Due to the growing number of patients with opioid addiction, the US has decided on guidelines to discourage doctors from prescribing opioid painkillers. Now, this includes not using pain scores. So you know what pain scores are. It's basically a scale from 1 to 10, and the patient lets you know how severe or mild his or her pain is by telling you a number. So 1 would be very mild pain, and 10 would be the most severe. So not using pain scores, that's what they're recommending. Now, you can see an obvious problem with this, because although this may decrease opioid addiction in the population, it will definitely not provide treatment for patients in genuine pain. So the author goes on to state solutions to this problem. And her solutions primarily center on communication between patients and their healthcare providers. So she says that the risks of addiction should be clear to patients, and they should be aware of the warning signs so that it can be addressed promptly. Now, the warning signs include mood changes, difficulty sleeping, oversensitivity to stimuli, so like touch, heat, things like that, and increased blood pressure. So these are all signs of dependence. She also says that healthcare providers should make it clear to patients that they should only take their opioid medication for the indication it was prescribed for, which is pain, and not for other reasons. Because sometimes people can use it to help them sleep, to treat anxiety or depression, and this unfortunately can lead to dependence. And she also says that they should take the prescribed amount and no more. So, in quote, "Through counselling and consultations, physicians and pharmacists can ensure that patients know how to use opioid medicine safely and responsibly." So that's her conclusion. And that's it for today. I'll be giving you a summary of another article pretty soon. See you later.